Thank you very much. Yes, perfect. Thank you. Yes, I'd love to be able to tell you how to make it simple, and I'm going to give you a little bit of help, perhaps. I'd just really like to thank the Immunisation Coalition for yet another absolutely fantastic meeting, and certainly for inviting me to present on the PneumoSmart vaccination tool today. I'd also like to pay my respects, of course, to the traditional custodians of the land that this meeting is being held on, the Whadjuk people of the Noongar Nation, and really acknowledge their continuing culture and the contribution that they make to the life of this city and to the region. So many of the sessions that you've been listening to today have probably really made you think. What I've experienced over my many years of life on this earth is that thinking can hurt your brain. So I'm actually going to be, this part of the day, just going to reduce your thinking and relieve that pressure in your brain. And particularly when it comes to trying to navigate the vaccine pathways against pneumococcal disease. So these are my, we'll go back, declarations. So I'd just also like to declare that I'm not a public health physician or an epidemiologist or a professor or any of the above. I'm a registered nurse and I am also a funeral and marriage celebrant if you are needing my services of any one of those. Hopefully not a funeral from pneumococcal disease, that would be kind of handy. So completely different skill set to a lot of the other presenters today. So this is what I'd like you to walk away with today, to really be able to sort of at least list off 3 of those medical conditions off that dreadful list that Paul just showed you, and also just be able to feel really comfortable about using the PneumoSmart tool. If you would like to get your phones out and your laptops out, we are going to have a couple of scenarios in the presentation. And if you wanted to have a little bit of a play with the tool, you can be putting those scenarios through the tool as we talk. You just need to Google PneumoSmart and accept the terms and conditions and you'll be ready to go. So a little bit of background from the way back when this tool really had to be considered, I suppose. And it really came with the release of the 10th edition handbook back in 2013. It became a little bit more complex. You know, there was healthy non-Indigenous recommendations, there was the healthy Indigenous, there was category A medical conditions, there was category B medical conditions, the category A medical conditions you got funded, the category B medical conditions weren't funded, but they were PBS listed. So it became really a bit of a nightmare. It also changed though from for Pneumovax 23 down to 3 lifetime doses. And I think this is where some of the fear has come in with providers talking to patients around pneumococcal vaccines, is because they have a little bit of a fear perhaps around perhaps they're giving more than 3 doses back then. So it certainly set the cat amongst the pigeons. So while I was working at what was the Adelaide, Central Adelaide and Hills Medicare Local at the time as their immunisation program coordinator and as a private immunisation education consultant, I ended up delivering rounds of education across South Australia. But we've always known that the pneumococcal chapter in the handbook is probably the worst chapter that's ever been written in the history of literature. And it's certainly the most difficult to interpret. There's quite a lot of ambiguity, and just the funding and the non-funding, etc., is complex. But what we found is there were really common fears from all of the providers across the regions. And so the one thing that they were really requesting was just a simple tool that can really quickly let them decipher what vaccines they should be offering their parents. And that request was really, really loud and clear. So while a simple tool originally was just going to be a really quick little flip chart and a series of flow charts for providers to follow, there was a pretty early realisation that this was just not going to happen. It's just not going to be adequate. And so some very, very clever IT people that really knew what they were doing came along, and we sort of developed this online pneumococcal algorithms tool. The tool was never developed, and still not developed, to replace pneumococcal catch-up vaccination for young children. Please use the proper catch-up calculator for that. It was really to help providers that had patients over 5 years of age that had all of these certain medical conditions that were putting them at the highest risk or at an increased risk of IPD. So it took us a number of months. The tool contained a little over 100 vaccine pathways in the back end, really trying to cover as many scenarios as that we possibly could. It kind of ended up putting me in a straitjacket, but we really did push on, and we thought this tool's got to be beneficial for the providers. But then along came a change of government, and the Medicare local network was going to get closed down, and so what were we going to do with the tool? And there was just so much work, along with my straitjacket, that was going to go in the rubbish bin if we didn't find a saviour. And along came Kim Thanson, and back then, of course, it was the Influenza Specialist Group, but now known as the Immunisation Coalition, who offered to host it, the tool on their website. So obviously over time, the tool has undergone many format changes and certainly frequent updates as the recommendations have changed over the years. As I said, the tool still does not replace the catch-up calculator for young children, but it will give you a little bit of a guide to what young children should have. Obviously, the major changes came back in 2020 when they had a big overhaul of the vaccination recommendations around pneumococcal disease. And, you know, God bless their cotton socks and everything, but they really tried to simplify it. I don't know that they succeeded, but anyway, we thought that it could have been the end of the tool if they did simplify it, but alas, we realised that the complexity was still there. And so we had the great big overhaul of the tool, and of course that resulted in myself going back into a straitjacket, along with Jane from the Immunisation Coalition and also Silas from the Immunisation Coalition. So we now have 15-valent and 20-valent vaccines. Paul's just talked about those. They have both been included in the handbook, as Claire rightly said. Neither of those two vaccines are NIP funded, but they are now an option for consideration. So they have now been added into the PneumoSmart tool. So here's your scenario. So get your fast fingers working and just let's walk it through. So we've got Gordon Charger, who's not a real patient, by the way. He's a new patient to your practice. You've done a comprehensive medical history, but he can't recall what vaccines he's previously received. His previous practice closed very suddenly 12 months ago, and he's unsure where all of his medical records went. So date of birth is there, 14th of the 9th of 1956. You can see that he's a smoker. You can see that he's a diabetic. And let's have a little look. If we were to put those medical conditions through the PneumoSmart tool, what would it show us? What we do know is that he is vaccine accepting. We've checked the AIR for his history, has a flu vaccine every year, which is good. He's had his COVID vaccines, including his boosters, and he even had a Boostrix vaccine. But there's no evidence on the AIR of pneumococcal vaccine. However, that's not unusual given the fact that the AIR only expanded in 2016 to capture adult immunisation data. So I'm going to give you a minute and put your hand up once you've run your scenario through the tool, and we'll see if we've got a summary at the end of it. So his diagnosis was after 12 months of age. He's identified as not Aboriginal or Torres Strait Islander. Lots of fast fingers are moving along. You're done, Claire? Yes, perfect. Did you find it easy? You've played with it before, very good. Yep, we've got a few other hands going up now. So it's just really a series of simple questions, and it's just a yes, no, unsure in most of those answers. So what we should get once we submit all of that information to the tool is a vaccination report. So it's going to give you a little bit of a summary up the top of your patient's name. I'm just going to also say that your patient's name and their date of birth does not get captured in the back end of the tool. The back end data is all de-identified data. That really is just there so the tool knows what age the person is that you're putting through the tool. But so if you print this summary off, you can scan it into the right patient's notes. So you can see really if you got to this stage of the exercise that Gordon has medical conditions, unfortunately, which you will see very frequently in general practice. However, they are not medical conditions that qualify for nationally funded pneumococcal vaccines. And so he would really need to be having a prescription written for the vaccines that you would be recommending for him. So there's the challenge. You've got all of those vaccines to recommend. He will have to go off to the pharmacy, get the prescription filled, bring it back. There's issues with cold chain, etc. And the vaccines are not cheap. Let's move on to scenario 2. So when you close your PneumoSmart tool down, you can either refresh it or just get out of the tool completely and come back in. Just saves confusing things. But we have Marigold Bushell once again, not a real patient, but she's a regular patient to your practice. You know her quite well. She's 47 years old, so born on the 16th of February, 1976. And she does identify as Aboriginal and Torres Strait Islander. She's a non-smoker, so she's a good healthcare worker, but she does have severe asthma. And she actually has had previous episode of pneumococcal pneumonia. So they were diagnosed after 12 months of age as well. So I'll give you just a minute or so for that. And let's see fastest fingers first. So in that drop-down box of medical conditions, if you go all the way to the end of the list, it actually does identify if the patient had no medical conditions. You can select none of the above if they have no medical conditions too. So this is the summary that you should have displayed at the end of that particular scenario. So you can see that's a little bit more extensive because she actually has had one dose of Pneumovax 23. And so therefore, we would be following that first table, that she's had one dose of Pneumovax 23, so she is due now to have a 13-valent or 15-valent and 20-valent. Of course, her 13-valent would be covered under the NIP because she has had a previous case of pneumococcal pneumonia, invasive pneumococcal pneumonia. So that makes her eligible for funded vaccine. If her only medical condition was severe asthma, though, it would be completely different, and she would be she would need to fund the vaccines that are recommended for her herself through private prescription. So for those of you that did get through those scenarios with the tool, did you find that it was reasonably quick and easy and relatively clear to use? Could you see yourself using this in your practices? Either the patient's in front of you, or you might want to do a targeted recall campaign and go through some of the patients that are in your practice management software and select some that have got these chronic medical conditions and make sure that they are vaccinated appropriately and maybe do some recalls. So The tool is updated regularly by a team of subject matter experts who absolutely live and breathe pneumococcal disease and vaccine pathways. It's pretty sad, but it's true. And after seeing this information from the tool, I really hope that you can see the benefits of using the tool to get an understanding of what vaccines are being recommended, what's the interval between the vaccines as well, and whether they're going to be funded or whether they're self-funded by the patient. Did you find the tool fairly easy, just using a Google search or whatever search engine you choose? So it's nice and easy to find, and it's just so important that these patients do receive the correct vaccine, the correct number of doses at the correct intervals, and certainly at the correct time to reduce that likelihood of pneumococcal disease burden. And so we're really hoping that more and more clinicians use the tool. So after we did the big revamp back in 2020, looking at some data from the back end, you'll see that the tool is being used, and I'm really hoping, like I said, that more of you will use the tool from here on in. So I'd really like to challenge you really to go back and at least select 10 patients out of your practice management software. I know that you're all super busy out there being the superheroes that you are, but I'd love you just to sort of set aside just a few minutes and select some patients, put them through the tool and see whether those patients really have been vaccinated appropriately. I'm going to finish a little bit early to give you some more question time if you need it. So thank you for listening, but don't be shy and use the tool. The tool does have a feedback function. So if you do find a glitch or you've got any questions to ask, please use that feedback function, and we will certainly get back to you. So thank you.
Thank you very much. So it's good to see you went from a straight jacket to SpongeBob SquarePants. So that was a good transformation. You have lived this for a long time. So invite any questions or any comments. I know people don't want to stand up and make a comment, but can someone see how they felt they've used it or used it before?
Who has used the tool before in clinical practice?